Hey everyone, do you know how to tell if an infant is developing normally just by observing simple activities like smiling, sitting, or crawling? In this video, I will explain the growth and developmental assessment of infants from 1 month to 12 months in a simple and exam oriented way. I'm Clesia Fernandez and welcome back to my channel. This topic is very important for nursing students, especially in child health nursing. Before we begin, if you find this video helpful, don't forget to like, share and subscribe to my channel for more simple nursing education videos. Now let us discuss the physical or biological development of infants from 1 to 6 months. This is a critical period because infants show rapid growth during these months. First, let's look at weight. During the first 6 months, infants gain weight rapidly. On average, they gain about 150 to 210 grams per week. A key point to remember is that the birth weight usually doubles by around 5 months. Next, let's talk about height. The average length of an infant is about 53 centimeters at birth, and it increases by approximately 2.5 centimeters per month during during these first 6 months. Now let's consider chest circumference. At birth, it's about 35 centimeters and it gradually increases to around 43 centimeters by 6 months. Finally, let's discuss dentition. Teething usually begins around 6 months, with the first teeth often being the lower central incisors. So, overall, the first 6 months are characterized by rapid physical growth, including weight gain, increase in length, and the start of teething. Now, let us continue with other important parameters in infant development. First, let us look at head circumference. Okay, head circumference increases rapidly during early infancy, especially in the first 6 months, and on the average, it increases by about 1 to 5 centimeters per month. This reflects the rapid growth of the brain during this period. Next, let us discuss about the vital signs of infants. So, the normal body temperature ranges between 36.5 degrees Celsius to 37.5 degrees Celsius. Then the normal pulse rate ranges from 110 to 150 beats per minute. The respiratory rate is around 30 to 60 breaths per minute, and the average blood pressure is approximately 80 by 50 mmHg. Now coming to the posterior fontanelle, so here I have displayed one image, that is this one is anterior fontanelle and this is posterior fontanelle. Okay, so this posterior fontanelle usually closes early, so typically by 6 to 8 weeks of age. Finally, let us look at an important formula used to estimate the weight of infant. Okay, so the expected weight can be calculated using this formula, that is age in months plus 9 divided by 2. So overall, these parameters including head circumference, vital signs, fontanelle closure and weight estimation are essential for assessing normal growth and development in infants. Now let us move on to the motor development in infants. Motor development refers to the development of movement and muscle control. So motor development is usually described in age groups. First, let us look at 2 to 3 months. At this stage, the infant shows a symmetrical posture of head and body. The head is usually maintained in midline or maybe turned to one side. The infant is also able to lift the head up to about 45 degrees when placed in prone position. Next, coming to 4 to 5 months, at this stage, the infant shows better control over body movements and maintains a more symmetrical posture. Okay, so the infant here is able to sit with support, and the infant can lift the head up to also the shoulder up to about 90 degrees. Now let us continue with motor development in the next age group. First, let us look at 6 to 8 months. At this stage, the infant shows improvement in sitting and body control. Okay, so the infant is able to sit for a short time in a leaning position, which means they may need support or use their hands to balance. Then gradually, the infant learns to sit with a straight back, especially when placed in a high chair. Then the infant may also try to pull into a sitting position when given support. When held in a standing position, the infant shows bouncing movements by bending and straightening the legs. Then, as development progresses, the infant is able to sit alone steadily without support. Then, it can also pull itself to standing with the help. Next, coming to 9 to 12 months. At this stage, the infant shows better coordination, balance, and control. Then the infant is able to sit alone with good stability and control over movements. The infant can pull to standing using furniture such as a chair or table. Then the infant is also able to move from a lying position, that is prone position, to a sitting position independently. Then when supported, the infant may attempt stepping movements. Then gradually the infant stands erect and may take a few steps. Then the infant may also start cruising, that is, walking while holding into furniture. Then, towards the end of this period, the infant may stand independently for a short time and may begin to walk a few steps on their own. So, overall, during this stage, motor development progresses from sitting with support to standing and early walking. Now let us move on to the fine motor development in infants. Well, fine motor development mainly refers to the use of small muscles, especially movements of the hands and the fingers. First, let us look at 1 month. At this stage, the infant usually keeps the hands in tight fists most of the time, right? So if an object is placed in an infant's hand, the infant is able to grasp it. Why? Because this is due to the palmar grasp reflex. However, the infant is not able to hold it for long and may drop it immediately. Next, coming to 2 to 3 months. At this stage, what happens? At this stage, the hands begin to open more often and may not always remain tightly closed. Okay, so the infant may briefly hold a rattle when it is placed in the hand. So the hands may be open or loosely closed, indicating improvement in control over hand movements. So overall, fine motor development progresses from reflex grasping to better control of hand movements during these early months. Now let's continue with fine motor development in the next age group. So at 4 to 5 months, there is a clear improvement in hand control and coordination. So the infants now keeps the hand mostly open rather than in tight fists. So the infant may also start playing with their own fingers, which shows increasing awareness and control. The infant is able to grasp objects that are placed near hand. Then the infant may also start reaching for objects, although the movement may not be very accurate and the infant may sometimes overshoot. The infant also brings objects to the mouth, which is a normal part of exploration at this stage. Grasping becomes stronger and the infant begins to use the thumb partially while holding objects. The infant is able to grasp objects using their whole hand, either left or the right hand. Then the infant may also hold one object while looking at the another object, showing increasing interest and coordination. So overall, during this stage, fine motor development shows improvement in grasping, reaching, and coordination of hand movements. Now let us continue with fine motor development in the next age group, that is 6 to 8 months. At 6 to 8 months, there is a significant improvement in hand coordination and control. So the infant is able to grasp objects using all the fingers and may even start using the fingers to feed themselves. The infant is able to transfer objects from one hand to the other, which shows better coordination between both the hands. The infant may also try to hold a bottle, although they may still prefer someone to hold it. And at this stage, the infant can hold two or three toys at the same time. The infant may even try to reach for a third object while holding two, showing increasing curiosity and coordination. Then the infant is also able to release objects voluntarily, which means they can let go of objects intentionally. Then a thumb opposition becomes complete, meaning the thumb can now move effectively against the fingers. Then this leads to beginning of the pincer grasp, which is the ability to pick up small objects using the thumb and the fingers. So overall, during this stage, fine motor development shows improved coordination, better control of grasp, and the beginning of more precise movements. Now let us look at the fine motor development from 9 to 12 months. At this stage, the infant shows better control of hand movements. The infant may bring two objects together and poke objects using fingers. Then the infant develops pincer grasp using the thumb and index finger to pick up small objects. Then the infant can put and remove objects from the mouth as desired. The infant may start drinking from cup, but spilling is common. Then the infant may also try to use a spoon, but cannot do it properly. Then the infant is able to pick up small objects and bring them to mouth. The infant enjoys eating with their fingers. The infant can release objects into containers, showing better control. So overall, the fine motor development becomes more controlled and coordinated during this stage. Now let us move on to the to sensory development in infants. So from 1 to 8 months, the infant's vision is still developing. So the visual acuity is around 20 by 200, which means that the infant cannot see very clearly. Okay, then from 9 to 12 months, the vision improves. So what happens to the visual vision? The visual acuity becomes around 20 by 100 to 20 by 50. So the infant is able to see more clearly. The infant also begins to search for a hidden or lost object such as a toy and shows more interest and persistence in finding it. So that's about sensory development. Next, let us look at psychosocial development in infants. Well, according to Erickson's psychosocial development theory, this stage is known as trust versus mistrust. So, at around 1 to 2 months, the infant begins to develop a sense of trust in the caregiver. If the caregiver meets the infant's needs such as feeding and comfort, the infant develops trust. If these needs are not met, the infant may develop what? The infant may develop mistrust. So the infant also shows egocentric behavior, which means the focus is mainly on their own needs. Okay, attachment is shown through eye contact, smiling, and vocalization. And these early interaction forms the foundation for future social relationships. At 3 to 4 months, the infant shows a strengthening of trust. Then the infant recognizes the caregiver's face, especially the mother, and smiles in response. Then the infant may stop crying when a familiar person appears. Then the infant also begins to show interest in new things around them. Okay, new stimuli or new things around them. Then at 5 to 6 months, the infant becomes more aware of the surroundings. That means here the infant may smile at their own image in a mirror. Then the infant may show displeasure when a toy is taken away. Then the infant recognizes parents and begins to differentiate strangers. At 7 to 8 months, trust increases. but the infant may also develop fear of strangers. Then the infant responds to their own name. Okay, then the infant may refuse interaction with stranger. The infant may show mood swings, such as crying or irritability. Then the infant may also dislike activities like diaper or clothing changes. Then there will be separation anxiety may be seen at this stage. The infant also begins to show likes and dislikes. So overall, during this stage, the infant shows increasing attachment, awareness, and emotional responses. At 9 to 10 months, the infant begins to show clear and recognizable emotions. Okay, emotions such as anger, sadness, fear, pleasure, and excitement. I'll give you one simple example. The infant may cry when it is upset, and it may show excitement when seeing a favorite person. Okay, the next one is the infant may develop fear of being left alone, which is also called as separation anxiety. So here the infant may start crying when the mother leaves the room. Then the infant may resist certain activities such as face washing. For example, the infant may turn the face away or try to cover the face while washing. Then the infant also begins to show preferences for certain toys. That means the infant may choose the same toy again and again. Okay. At 11 to 12 months, the infant shows pleasure when a desired action is completed. What does this mean? For example, the infant may smile or clap after successfully picking up a toy. Okay. Then the infant may become frustrated when restricted. Okay, so if the infant, like here, the infant may cry when a toy is taken away. The next one is the infant starts seeking approval from caregivers. And at this stage, the infant may look at the parent after doing something, expecting a reaction. Okay, and at this stage, a sense of trust is established if the infant's needs are met. And if the infant's needs are not met, then they may develop mistrust. Okay, so mistrust leads to fear, jealousy, anger, and insecurity. So the infant may also cooperate during dressing. For example, the infant may put the arms into sleeves or feet into shoes when assisted. So overall, during this stage, the infant shows stronger emotional expression, attachment, and social interaction. Okay, let us now look at psychosexual and spiritual development in infants. Well, according to Freud's psychosexual development theory, infants are in the oral stage from birth to 1 year. So, what happens at this stage? At this stage, pleasure is mainly derived from mouth related activities. Okay, what are those activities? The activities such as sucking, then feeding, and putting objects into the mouth. So here, oral aggressiveness may also be seen, which is expressed through behaviors like biting and chewing. Then spiritual development. Now coming to this, so during the first year of life, the infant is in the undifferentiated stage. At this stage, the infant is not able to differentiate or understand spiritual concepts, but begins to develop basic feelings of trust and security. So overall, these aspects contribute to the holistic development of the infant. Next, let us look at intellectual or cognitive development in infants. Well, according to Piaget's cognitive development theory, infants are in the sensory motor stage from birth to 2 years. Okay, at this stage, learning occurs through senses and motor activities such as seeing, touching, and moving. So the first one is reflex use, birth to 1 month. So during the first month, behavior is mainly based on reflexes. So the infant does not clearly differentiate between self and the environment. Then the second stage is primary circular reaction, 1 to 4 months. From 1 to 4 months, the infant repeats actions centered on their own body. For example, the infant may suck the thumb repeatedly because it is pleasurable. Then the third stage is secondary circular reaction. Okay, from 4 to 8 months, the infant repeats action to produce effects on the environment. For example, the infant may shake or rattle again and again just to hear the sound. Then fourth stage is coordination of secondary schemes. From 8 to 12 months, the infant begins to combine learned actions to achieve a goal. Then there will be simple problem solving, which will develop at this stage. For example, the infant may move an object to reach a toy. So overall, during the sensory motor stage, the infant learns through interaction with the environment and gradually develops thinking and problem solving abilities. Let's discuss moral development. Well, at this age, infants are just beginning to understand the world around them, and at this stage, a baby thinks that the good is what I like and want. This means that their sense of right and wrong is based on their own desires. The next one is language development. So here, specifically the receptive language, which is how babies understand words and sounds. At 1 to 6 months, babies respond to human voices. They show alert expressions when listening. Then they recognize their mother or caregiver's voice. Then they look in the direction of the speaker. They start to recognize repeated words or similar words. Then at 7 to 12 months, they respond to their own name. They stop activities when their name is called. Okay, then they verbally respond to adult anger. For example, they may cry or pause. Then they can understand simple commands like come here or give me the toy. So by observing these milestones, we can understand how infants start connecting sounds, words, and social cues. Well, next is expressive language. Here it tells us how babies communicate and produce sounds. Okay, at 1 to 6 months, babies or infants open and close their mouth when adults speak, and this is called as early attempt at communication. And they cry when hungry or uncomfortable. Okay, so their main way to express, that is their main way to express needs. Then begins cooing, that means making sounds like a or oo. Then crying changes depending on reason, that means the reason may include hunger, pain, or sleepiness. Then they make basic syllables, that is laying the foundation for speech later. At 7 to 12 months, so the infant vocalizes several well-defined syllables. Then they vocalizes when crying, imitates simple noises and speech sounds, vocalizes da, ma, and ba. Then babbling continues syllables like dada or mama. Then cry when scolded. Then understands meaning of bye bye and they wave back. Then may speak two or more words beside mama and also dada. Then they understand meaning of many more words than to be spoken. So that means they cannot speak much, but they can understand the meaning of whatever that is spoken to them. Now let's learn the now let's learn about play stimulation in infants. So let's go through it according to the age groups. So 1 to 3 months, onlooker play. So here offer a rattle, hold or dangle toy in front of the infant to encourage eye movements. Then change patterns of objects from bright to shiny or dull or dark for further stimulation. Then 4 to 7 months, solitary play. So this means that place infant when awake where household activities are in progress. That means include infant in family's television viewing and activities. Okay, encourage playing in water or swimming in a shallow tub or pool. So gently push infant from a sitting position to improve balance at 8 months. So that is about solitary play. At the 8 to 12 months, continue infant games like pat a cake and peekaboo with motions, then provide opportunities for holding and releasing objects, encourage cruising by placing furniture in a circle so that the child can walk holding the furniture, then support bouncing in a standing position by holding the infant's hands, then place the infant in a jumper seat to encourage standing and jumping, then play simple games like rolling a ball to the infant, then encourage the infant to stand alone by gradually decreasing support, then encourage walking by eventually holding only one hand. So from 8 to 12 months, play activities help infants develop movement, balance, and coordination while also making play fun. So, in today's class, we learned about infant growth and development milestones. We covered motor development, spiritual development, psychosexual development, psychosocial development, moral development, language development, play stimulation. Okay, so remember these milestones help us understand how infants grow, learn, and explore their world, and guide us in providing proper care and stimulation. So if you found this video helpful, don't forget to like this video, share it with your friends and classmates, subscribe to my channel for more nursing classes and growth and development lessons. Thank you for watching and I'll see you in the next class.